Hey guys, what's up? I'm Eleni. I'm a second year dental student. Today is Monday, August 27th, and it's my first day of second year. I'm so excited to be starting. I can't believe I'm already here in my second year. I feel like I just started my first year. I feel like orientation was just the other day, but I'm really excited to start. Today we have a Q&A at 11:30 for our first class that we're doing, which is Introduction to Clinical Protocol, and this will be like a 2-week class that we're starting, and I think it'll be just like very easy, and it's nice because it's kind of just like easing us back into school, which is really nice. They did that for us last year. They kind of started us off easy before they started all of our hard science classes, so I think after this course we'll start all of the other harder science classes. So yeah, we're starting with this class, and yeah, I'm really excited to start school, and I have this Q&A at 11:30, and then afterwards I'll probably just work on some coursework that they gave us, some videos to watch. So yeah, I'm excited. And in the spirit of the first day of school, I'm wearing my Fig scrubs and I have my teeth earrings in, so as you can tell, I'm really excited to start school again. So yeah. Okay guys, so we just had the Q&A and they basically just introduced the class to us and we got to ask questions. So now that we've had the Q&A, there's some videos I need to watch on Canvas, and there's some things that I need to fill out, but I'm also going to fill in my planner and write everything down that I need to do and write all the classes for the week so I know what's coming up, and fill in all of my quizzes and assignments for August. So that's something I'm just going to work on right now quickly, and then do some of the coursework. Okay guys, so I finished writing in my passion planner, what I had for this week, and basically how this class is going to go is there are modules on Canvas online that we have to go through ourselves, and then each day there's going to be a Q&A session where we can ask the teacher if we have any questions, and then on Wednesday of this week I have an Axiom training with my group practice, and then I have a second training for Axiom next week, and then the quiz will be next Friday. And yeah, so then every day we'll have a Q&A, and so there's some modules that I have to go through on Canvas, one being medical history and the other one being the head and neck exam. So I'm just going to do that now, and then also there's an Axiom training that we have to do before the group practice meeting that I have on Wednesday, so I'm just going to work on that now. Hey guys, so it's the next day. It's now Tuesday, August 28th. I already did yoga this morning. I like this one yoga on YouTube, and her name is Shauna Virtue. I'll make sure to link it down below so you guys can check it out if you want. I've recently been so into yoga. I've always wanted to get into it, but I never went and did it. And so over quarantine, there was one day and Kyle was like, let's just do yoga. So we've basically been doing yoga ever since we kind of got into the habit of it. So I'm really liking it. I've always known that yoga has been really good for stress and for students, especially dental students. It's been proven that it helps you with your grades and obviously within any anxiety or stress you might have with school. So I've really been enjoying doing yoga. And yeah, so I follow this girl on YouTube, Shauna Virtue, and I just do like the same morning yoga every day, or sometimes I'll do a running yoga that she does after I run. So after I did yoga, I had my breakfast and I had avocado on a bagel and 2 scrambled eggs. That is like my favorite breakfast to have. I basically have that every single day. And then I went for a run. I ran on my treadmill that's in my basement because it's 90 degrees out today, so I didn't really want to go outside. So after that, I did a Chloe Ting workout. This girl is really good. I do her ab workout and the butt workout, and they're only 10 minutes each, so I like how quick it is and it's very difficult. And yeah, I love it. So I'll do that after I run, and then so after that we had the Q&A session, so I just logged on to that at 11:30, and then I just took a shower. And now it's around 1 o'clock. I started working on the Axiom training that we have to do. And so basically we have to fill in like a fake patient on the patient record on Axiom, which is like the patient, history records. And so I'll show you guys what that looks like right now. So this is what Axiom looks like. So you can see up here is the odontogram, which I think it's called. I have to do that next, so I have to watch a video on that. But basically what we had to do was just fill in the patient history. So I had to go in and fill out all of these questions, and basically it's just going through, and I just put no for a lot of them because there are certain things that we had to fill out, like the date of birth, pulse, blood pressure. So I filled in all of that, and then most of the other things I just filled in no. This fake patient has diabetes, so I filled that in, and their medications that they take, so that I've already done. And now I have to do the other part of it, which is filling out which teeth they have missing, or with caries, or with whatever they might have on their teeth. So I have to fill that part out. And yeah, that's what I'm going to be working on today. There's a few lectures that I need to get through. And yeah, that's what my day is going to be like. Yeah, so it's just all about getting to it. There's like a ton of other things that I want to do, but I have to get this done first. So I'm forcing myself to get my work done, and I have my Mary Lou's coffee. I got this yesterday. I got the Milky Way, which I've never tried before, and it's really good. I haven't had coffee in so long, so I was like buzzing with that little bit that I had yesterday, so I saved the rest for today. So I'll have a little bit of that to help me get going. But yeah, so I'm just going to be working on this training right now and going through the videos.
Messages, even though you're not in clinic yet, and you are able to open Axiom until you open.
Okay guys, so I just finished filling in the chart. It was kind of fun because I just looked at the x-rays and then I filled in the chart based on what I saw in the x-rays, so it was kind of fun doing that. I'll show you guys. So I just looked at these x-rays here and I kind of had to figure out like which tooth was which and remind myself of the numbering, but then I just went over here and filled in the chart and either put in if there was a missing tooth, if the tooth had a composite or amalgam filling, and yeah, that's basically what I did. And for now, just like easy, simple chart. And yeah, so that was kind of fun to do. So I think I've finished the Axiom training that I need to do. So now I'm just gonna go and watch the lectures that I need to watch for today. Hey guys, it's now Wednesday. I had a pretty busy morning. I got up early and I went for a run. I did about 3 miles, so that was really good. And then I did a Chloe Ting workout. I did her ab workout, and then I also did her butt workout. And then I had breakfast, and I had the Q&A at 11. And now I'm finally sitting down to work on the next part of the Axiom training, and that is the treatment plans. So there's a video I need to watch, and then I need to go into the training and the fake patient that we have and figure out which treatment plans I should do for this fake patient. So that's the next thing that I'm going to be working on. And then at 2:30 I have the group practice meeting, and that's going to be a separate workshop that we're doing. It's a separate workshop that we're doing with our group practices on the Axiom training, so that should be good. Yeah, so that's what I have going on for today, and I feel like I'm already falling behind, but that's okay because tomorrow we don't have like any live sessions, no Q&A tomorrow, so I'll have all day tomorrow to catch up with my work and work on these self-assessments that they've given us. And for each module that we're going through, there's a self-assessment, and those questions in the self-assessment will be the questions that are going to be on the quiz next week. So I'll go through those probably tomorrow. So yeah, that's what I'm going to be working on today and tomorrow. So yeah. Hi you guys, it's Thursday now. I'm finishing up some work that I had to do for Axiom, and it's been difficult getting back into the work, so I haven't really been that productive with my schoolwork this past week. So today I'm trying to really focus and sit down and do my work. So I finally was able to finish my Axiom training, that was like supposed to be done yesterday. So I finished all of that, and then I still have to work on all the videos, all the modules, and all the self-assessment. So I'm hoping to get a big chunk of that done today, but I wanted to just show you guys really quickly what I've been doing on Axiom. So this is the fake patient that we have in their record. So it's a little blurry, but if you can kind of see here, this is the odontogram, and basically we just had to fill in all these teeth from an x-ray that we were given, and the patient had a few fillings, a fractured tooth, some more fillings, some missing teeth. So we had to go in, figure out how to add in all those things, and then we also had to fill in the health form for the patient. So there's a bunch of like questions here that we had to go in and answer. So it's a lot that you have to fill in for your patient. And then we also had to do the medical consult, which is what I just finished. And basically what we had to do was look up the medications that the patient is taking, and then look up the different anesthetics, analgesics, antivirals, antifungals that would interact with those medications, because those are the different medications that you wouldn't be able to use for this patient. So it's really important to know what your patient is taking and knowing what they can't use with those medications that they're taking. So if you have a diabetic, so for example, this patient was taking metformin, there are certain antibiotics that they can't take because that will interact with the drugs that they're already taking, and you have to be careful with the anesthetic because they can have hypoglycemia. So it's really interesting how, as a dentist, there are so many things that you need to know about the person's health and about their underlying conditions and about the medications that they're taking. So it's really interesting going through this and having to think about all these other things besides just teeth and the health of the mouth. It's also the health of the entire person. So I think it's been really cool going through this, and yeah, I find it so interesting and exciting to be using Axiom. I know probably once we're actually seeing patients, it's not going to be as fun anymore, but for now it's fun learning about it and how to use it. And I like it because it's super organized and there's a place for everything that you have to fill in. So it's kind of fun going in and filling stuff out. So I've been liking that. But okay, so now that I've finished that, I'm going to go and watch some lectures that we have to go through, do some self-assessments, some questions that we need to do. And yeah, that's basically what I'm going to be doing today, since I haven't been very productive the rest of the week. So yeah. Hey you guys, it's Friday now. I didn't really vlog today because I'm at my boyfriend's house now. We're going to Martha's Vineyard tomorrow, so I'm really excited about that. But today I just did a little bit of work. I finished the Axiom training that we're supposed to do. So I did the treatment planning and I also did the record of exam. So basically the record of exam is just more questions that you have to fill out about the patient. So it's where you write about the head and neck exam. So if you see any skin discolorations, you check for lymph nodes, you check for lesions in the mouth, all those kinds of things. So you write that in the record of exam section. And then obviously treatment planning is when you plan out the treatments that you're going to be doing for the patient. So we kind of just made up things as we go because we obviously haven't learned yet what specific treatment plans to make for certain diagnosis and certain findings, but it was mostly just to figure out how to use Axiom. And I actually found it kind of fun to put in the diagnosis and the findings and put in the different treatment planning. I'm sure it won't be as fun when I'm finally in the clinic, but for now I kind of liked it. I guess this is the end of my first week of my D2 year. It's obviously not how I would want it to be, but it's better than nothing. And I guess my year, I think we're really lucky because we still have plenty of didactic classes, so we can get all those classes done before January, which is when hopefully we'll be going back and starting all of our clinical lab work and all that stuff. So I think that as a second year, we're really lucky because we haven't yet entered the clinic, and there's still time for us to do online classes, so we can finish all of that before we actually do go back to school. So obviously it's not the best not being in school, but it's not the worst either. So I'm just trying to make the best of it. And yeah, I think it's going to be a great semester, and I'm excited to start it. So yeah, I guess I will end off my video here, and I hope you guys enjoyed this video. Make sure to subscribe. I will be having plenty of vlogs coming up. I want to vlog as much as I can this coming up semester, just to get more content to you guys, just to see what it's like as an online student, what dental school is, the content that we're going through right now. I think it's going to be very exciting content because we're going to be doing a lot of teeth related, oral related classes like oral pathology, orthodontics, I think, and some other classes that I can't remember right now. But yeah, so make sure you guys are subscribed to not miss any of my videos, and thank you guys so much for watching, and I hope to see you guys in my next video. Bye.